Main diseases we are going to treat in the center in Dubai, in the United Arab Emirates, will be cancer, integrative cancer treatments, will be treatment of diabetes, type 1 and type 2, will be infertility, and orthopedics and neuromuscular diseases. What forms of cancer can be treated? Basically, all forms of cancer should be treated, to our opinion, by a combination of traditional chemotherapy and radiation therapy, if necessary, but quite often by checking for the circulating tumor cells and the sensitivity of the tumor cells, we can set up a much more precise, individualized treatment protocol for the patient in the given situation. It's likewise the treatment of the diabetes. We will pick up the patient at the stage of the disease. Is it the early stage, the honeymoon period, or it's a long-lasting diabetes where we primarily want to avoid side effects of long glycosylation of lipoproteins. Sometimes we will work with stem cell therapies. Other indications will be infertility treatments for the male and for the female. It could be the erectile dysfunction, it could be the premature failure of the ovaries, it could be other forms of infertility. To summarize, main focus of our therapeutic concept is photobiomodulation. So the use of specific wavelengths of light, and all our cells can use different wavelengths of light. We target on mitochondrial medicine, therefore we can treat a huge variety of different diseases, really from head to bottom. We can treat premature balding, loss of hair. We can do facial regeneration. We can treat hearing loss, tinnitus. We have good concepts for acute and chronic sinusitis, for allergic diseases, for allergic rhinitis, allergic conjunctivitis, thyroid disease, early stage of Hashimoto disease, autoimmune diseases of the thyroid gland. We have great concepts for myocardial insufficiency, for acute and chronic asthma, bronchitis, COPD. There are good concepts for chronic inflammatory bowel disease, for Crohn's disease, for ulcerative colitis, for IBS, irritable bowel syndrome. And of course, one of the great, fantastic options is the treatment of osteoarthritis. When it's the early stage, grade 1, grade 2, the transdermal laser irradiation will be extraordinarily effective. If it's a more advanced stage, grade 3 to 4, then we would combine the power of the laser with a targeted use of platelets that are anti-inflammatory PRP and the injection of stem cells. Then we would perform interstitial and intra-articular irradiation with the laser with single-use sterile optic fibers.